Table of Contents Acknowledgements Abbreviations Glossary Introduction General Standards for Diseases 0001 Principal Diagnosis 0002 Additional Diagnoses 0003 Supplementary Codes for Chronic Conditions 0005 Syndromes 0008 Sequelae 0010 Clinical Documentation and General Abstraction Guidelines 0011 Intervention Cancelled or Not Performed 0012 Suspected Conditions 0015 Combination Codes 0025 Double Coding 0026 Admission for clinical trial or therapeutic drug monitoring 0048 Condition onset flag 0049 Disease codes that must never be assigned 0050 Unacceptable principal diagnosis codes 0051 Same-day endoscopy, diagnostic 0052 Same-day endoscopy, surveillance general standards for interventions 0016 General procedure guidelines 0019 Intervention abandoned, interrupted or not completed 0020 bilateral/multiple procedures 0022 Examination under anesthesia 0023 Minimally invasive interventions 0024 Panendoscopy 0029 Coding of contracted procedures 0030 Organ, tissue and cell procurement and transplantation 0031 Anesthesia 0032 Allied health interventions 0037 Pediatric procedures 0038 Procedures distinguished on the basis of size, time, number of lesions or sites 0039 Reopening of operative site 0042 Procedures normally not coded 0044 Pharmacotherapy 0047 Adhesion specialty standards 1 Certain infectious and parasitic diseases 0102 HIV/AIDS, human immunodeficiency virus/acquired immune deficiency syndrome 0104 viral hepatitis 0110 sepsis and septic shock 0111 healthcare associated staphylococcus aureus bloodstream infection 0112 infection with drug-resistant microorganisms 0113 coronavirus disease 2019 COVID-19 2 Neoplasms 0206 Pharmacotherapy for neoplasms 0222 Lymphoma 0229 Radiotherapy 0233 Morphology 0234 Neoplasms of contiguous or overlapping sites, or with localized spread 0236 Neoplasm coding and sequencing 0237 Recurrence of malignancy 0239 Metastases 0245 Remission in malignant immunoproliferative diseases and leukemia 3 Diseases of the blood and blood-forming organs, and certain disorders involving the immune mechanism 0302 Blood transfusions 0303 Anticoagulant use and abnormal coagulation profile 0304 Pancytopenia 4 Endocrine, nutritional and metabolic diseases 0401 Diabetes mellitus and intermediate hyperglycemia 0402 Cystic fibrosis 5 Mental and behavioral disorders 0503 Drug, alcohol and tobacco use disorders 0505 Mental illness in pregnancy, childbirth and the puerperium 0506 Adjustment/depressive reaction 0512 Personality trait/disorder 0530 Drug overdose 0534 Specific interventions related to mental health care services 6 Nervous system 0604 Cerebrovascular accident CVA 0625 Quadriplegia and paraplegia, non-traumatic 0629 Stereotactic radiosurgery, radiotherapy and localization 0633 Stereotactic neurosurgery 0634 Cerebrospinal fluid drain, shunt and ventriculostomy 7 eye and adnexa 0701 Cataract 8 Ear, nose, mouth and throat, ENMT. This chapter intentionally left blank 9 Circulatory system 0909 Coronary artery bypass grafts 0925 Hypertension and related conditions 0933 Cardiac catheterization and coronary angiography 0934 Cardiac and vascular revision/reoperation procedures 0936 Cardiac pacemakers and implanted defibrillators 0940 Ischemic heart disease 0941 Arterial disease 10 Respiratory system 1006 Ventilatory support 1008 Chronic obstructive pulmonary disease COPD 1012 Influenza due to identified influenza virus 11 Digestive system 1103 Gastrointestinal GI hemorrhage 12 Skin and subcutaneous tissue 1204 Plastic surgery 1221 Pressure injury 13 Musculoskeletal system and connective tissue 1,309 dislocation or complication of joint prosthesis, 1,353 Bankart lesion, 1,354 slap lesion, 14 genitourinary system, 1,404 admission for kidney dialysis, 1,428 diethylstilbestrol (DES) syndrome, 1,438 chronic kidney disease, 15 pregnancy, childbirth and the puerperium, 1,500 diagnosis sequencing and obstetric episodes of care, 1,505 delivery and assisted delivery codes, 1,506 fetal presentation, disproportion and abnormality of maternal pelvic organs, 1,511 termination of pregnancy, abortion, 1,521 conditions and injuries in pregnancy, 1,544 complications following pregnancy with abortive outcome, 1,548 puerperal/postpartum condition or complication, 1,549 streptococcal group the infection/carrier in pregnancy, 1,550 discharge/transfer in labor, 1,551 obstetric perineal lacerations/grazes, 1,552 premature rupture of membranes, labor delayed by therapy, 16 certain conditions originating in the perinatal period, 1,602 neonatal complications of maternal diabetes, 1,605 conditions originating in the perinatal period, 1,607 newborn/neonate, 1,610 sudden infant death syndrome/apparent life-threatening event, 1,611 observation and evaluation of newborn and infants for suspected condition not found, 1,613 massive aspiration syndrome, 1,615 specific diseases and interventions related to the sick neonate, 1,617 neonatal sepsis/risk of sepsis, 17 congenital malformations, deformations and chromosomal abnormalities. This chapter intentionally left blank 18 symptoms, signs and abnormal clinical and laboratory findings, not elsewhere classified, 1805 acopia, 19 injury, poisoning and certain other consequences of external causes, 1901 poisoning, 1902 adverse effects, 1903 two or more drugs taken in combination, 1904 procedural complications, 1905 closed head injury/loss of consciousness/concussion, 1906 current and old injuries, 1907 multiple injuries, 1908 open wound with artery, nerve and/or tendon damage, 1909 adult and child abuse, 1910 skin loss, 1911 burns, 1912 sequelae of injuries, poisoning, toxic effects and other external causes, 1914 degloving injury, 1915 spinal cord injury, 1916 superficial and soft tissue injuries, 1917 open wounds, 1918 fracture and dislocation, 1919 open intracranial injury, 1920 open intrathoracic/intra-abdominal injury, 1922 crushing injury, 1923 contact with venomous/non-venomous creatures, 1924 difficult intubation, 20 external causes of morbidity, 2001 external cause code use in sequencing, 2005 poisonings and injuries, indication of intent, 2008 perpetrator of assault, abuse and neglect, 2009 mode of pedestrian conveyance, 21 factors influencing health status and contact with health services, 2,103 admission for post-acute care, 2,104 rehabilitation, 2,105 long-term/nursing home type inpatients, 2,108 assessment, 2,114 prophylactic surgery, 2,115 admission for allergen challenge, 2,116 palliative care, 2,117 non-acute care, 2,118 exposure to tobacco smoke, 2,119 socioeconomic and psychosocial circumstances,